All right, good evening. Can you hear me, Dr. Rubin?
I can.
Okay, awesome. And I'm hoping we don't hear my puppy in the back. So it is 7 o'clock. We'll give people a few minutes to come on, and then we will get started. We're already getting questions in the chat, so I think maybe we'll just go ahead and just jump in. So, good evening, everyone. My name is Dr. Lisa Green. So, hello and welcome to the Cook County Department of Public Health tonight on their monthly Ask the Doctor series. This is another way and opportunity that the Cook County Department of Public Health has really aimed to ensure that information is not just kept separately, but how partnerships really come together for people that are in the community, that are doing the work, and the dedicated people who are really trying their best to ensure that we're safe, we're educated about what's happening in COVID. And so this series is just another example of how that opportunity is really bringing healthcare to the community. And so tonight we are honored to have Dr. Rachel Rubin on, who is the co-lead and senior medical director at the Cook County Department of Public Health, with me tonight to answer your questions about COVID, vaccines, the new Omicron, mask, and everything. And I have to stop to say, we've worked together on several projects, but it is really such an honor to have the ability to have the conversation with you tonight. When we think about all the devastating things that COVID has done, people have lost lives, people are exhausted. It rocked everything. But what it also did is it leveraged new relationships. It enhanced partnerships. And so I am very grateful as a community, partner out in the Southland to really see the work that the Cook County Department of Public Health has done. And so you have done an outstanding job. Whereas for some of us that are in the community, sometimes we think, these are the people that are sitting at a desk in an office somewhere and they're watching the numbers and giving instructions. But I think tonight is another example where you take the time, you take the heart to understand and to meet people where they are. So I am very excited about having this conversation with you tonight and just the work that you've done over this last almost 2 years. Oh my God.
Dr. Green, it's such a pleasure to be here with you today. And I want you to know that you are one of my heroes, and the work that you do in the Southland and the Family Christian. I mean, I've known about your work for years, even before we started to do some work together and collaborating. And you are one of our champion community partners. I wish everybody could do what you do and as well as you do it. So thank you so much for having me tonight.
Yeah, no, I think this is great. And, we want to thank the Cook County Physicians Association for sponsoring this series, because I think it's important that people will know, that they give information for people that are, looking at this globally, regionally, but you're bringing it to people where they are and having the questions asked, in a safe space and in a way, having conversations like this is really just that. It's a conversation, because a lot of times, we have patients or we as people, we follow things on the news and then droop is gone. You don't really get a chance to ask those questions. So I am grateful for the series and grateful to have you tonight. So I think that we need to let everyone know that this is being recorded. So you can go back and watch this on Facebook. You can watch this on, Twitter, on Instagram. And really, if there are questions tonight that don't get answered, please make sure you go to look at the Cook County Department of Public Health website. But tonight we'll dive into COVID. We had this set up a couple weeks ago. But when we had this set up a couple weeks ago, who knew that we would have the conversation that we're having tonight? And so I just think, I'm honored to be having this conversation with you tonight when there's so many questions that are out there. And so we're going to kind of jump in. But before we do that, we really want to hear from you to kind of what is your take on this whole Omicron. Before we, dive into this conversation with the questions, let us know what your thoughts are.
Yeah, no, thanks a lot. It wasn't surprising that we were to see a new variant. And the only thing that I would say, or the main thing that's sort of surprising, is that this latest variant has so many mutations on that so-called spike protein, which is how the virus gets into our cells. That spike latches on to a little receptor on the cells and then can get in that way to infect it. So therefore, the vaccines are really targeted at that spike protein predominantly. And to have so many different changes in that spike protein makes us wonder, about the effectiveness of vaccines, which we can get into in the program. But, it's something that was not really unexpected, because we haven't vaccinated enough people in this country, much less worldwide. This is really a world problem. This is not just a problem of the United States. It's certainly not just a problem of South Africa. And I have to say, it's pretty disturbing to me that we put all this focus on the Southern African region, which is dear to my heart because I lived and worked in Mozambique for 2 years, which is one of the neighboring countries.
Okay.
It's just to the north of South Africa along the Indian Ocean, beautiful country. And to say that we are restricting travel from these 8 countries, in sub-Saharan Africa, when we learned yesterday that there was a case that was diagnosed retrospectively, but that had appeared in the Netherlands. And then also we heard earlier today in Nigeria, which is much to the north of South Africa, that these were diagnosed before the first cases. They were in people that were infected before the first cases were infected in South Africa. So we don't really know where this particular Omicron variant really started. But that being said, this is really a worldwide problem. And closing borders is not really the main solution, right? What we should be
Right.
doing is getting vaccines sent all over the world so that everybody has the opportunity to get vaccinated. And what it also means for our communities locally and in the state and in the United States is that we need more people vaccinated here. And we need people to get the booster if they are eligible for it yet. And that's because the more people that are vaccinated, the lower level there is of any variant of the virus floating around in our communities and being there for people to be infected and then giving it to other individuals. Because the lowest amount of vaccine that is circulating in our communities, the less like a new variant can sort of take hold and take grip in our communities and infect people. Also, what we are almost certainly going to be borne out, and we should know this within a few weeks, is that even if the current vaccine isn't quite as good a match for the Omicron variant as it has been for other variants, including the Delta variant, so we might see so-called more breakthrough cases, which means people who get sick with COVID even when they've been vaccinated, but it almost certainly is going to continue to protect people from getting severe disease and dying from it.
So that leads us straight into this first question. So, and thank you for that information. First of all, I thank you for applauding and acknowledging how the borders have gotten restricted, right? And when you look at what's happened, and there's still a lot that we don't know, but what we do know is that the vaccine still has been our best, army device that we have, within our immune system to help us fight this off. So now that we have this latest, COVID variant, what worries you the most about this variant? And again, you mentioned that it's not a local, just Cook County Department of Health. This is a national problem. This is a global problem. So in those aspects, what worries you the most about this variant?
What worries me most about the variant is that if we don't ramp up our vaccination coverage, we might very well begin to see it spread throughout the United States. Today, the first case was diagnosed in California in somebody who had been in South Africa and had returned home. And he returned home on the 22nd of November, so a little over a week ago. And he started to get sick a couple of days ago, and his tests over the weekend turned out positive or was confirmed today. So what worries me is that we will begin to see people getting sick from this variant if they do not, that it could potentially overtake the Delta variant, which is the most predominant variant that we're having right now. Most everybody that gets infected now has the Delta variant. And we were hoping, okay, we're getting vaccinated, we'll get this Delta variant under control. But we haven't done that yet. If we had, I wouldn't be so concerned about the Omicron. It probably wouldn't take hold. And it may not in the United States. It's not like I'm saying it's inevitable. But we need to get, what worries me the most is that the people that are not yet vaccinated are going to be getting COVID with the Delta variant and ultimately the Omicron variant. And if they are at high risk, or if they are in contact with people who are at high risk for complications from COVID, we're going to begin to see more cases and more deaths out there. And we don't want to see that happen.
And tonight for our audience, could you clarify, because I think that's the piece that we have to keep getting out to our communities. What qualifies you as high risk, so that people know what that looks like? Because a lot of times people say, well, I've got diabetes, but it's under control. That doesn't put me at risk. Absolutely, it still puts you at risk. So what puts you at risk if for this new variant?
Sure, the things that put you at risk, or the conditions or situations that put you at risk, are if you are older, because as we get older, our immune system tends to age along with the rest of us, right? And is less effective in fighting off infection, even if you've had a vaccine. So these are folks, they say above the age of 65, which I am closely approaching, unfortunately, or
No, it's
fortunately,
amazing
or
because years ago
fortunately.
as a kid, I can remember saying, "Oh, they're really old. I think they're like 30." And now, oh my God, 65 is not old at all, right? So that
65 is
concept, the
young,
closer you
70
get,
is
you're like,
young. It's
"Oh
still
no,
middle
that's not
age.
right."
Yeah, exactly. So if you're older, if you have underlying chronic conditions, even if they're under good control. Now, of course, if you have diabetes that's under good control, you're much less likely to have complications from COVID than if it's not in control, but it still puts you at increased risk.
Good.
People that have underlying immune compromising conditions, even if they feel well, but they're on a medication that decreases their ability for the vaccine to work well in their bodies. So these
Right.
are people like that have had organ transplants, kidney transplants. Somebody who's been on dialysis, they then get a kidney transplant. It's like a new life. They don't have to be tied to a machine 3 times a week. They can go and do whatever they, used to be able to do. I mean, in careful situations, but they're on medications that suppress the immune system so you don't reject that organ. So organ transplant patients, people that have certain kinds of specific types of cancers, of whatever age, people that are on medications that suppress their immune systems for other conditions, like certain kinds of what we call autoimmune diseases, right? Where your immune system sort of fights against itself. So you need to suppress your immune system so that doesn't happen. So these are other kinds of conditions that are very important. And then also people that live in congregate settings. So it could be your child, your nephew, your neighbor's child who has a severe developmental disability and lives in a congregate setting, lives in a group home. People that are living in nursing homes, even who don't have severe underlying medical conditions, because they're living in such close proximity with people that are
Right.
in homeless shelters, because it's a situation where the spacing between people is not very careful, and people are caring for you and they go from one person to another to another. So a caregiver can have an asymptomatic case of COVID and not even know it, and they're going from one room to another in a nursing home or in a group home to help you out, and they're passing it on to you and they don't even know it. So these are the people that are at high risk of having complications, and the workers that take care of these people, if they need caregivers, are definitely, and all of our essential workers, all of our healthcare workers, all of our people that work in retail and restaurants, that work in factories, all of these folks, all of us need to be vaccinated, because we are the ones that are out there and about in the world. We're not just teleworking at home and not dealing with anybody else, so we can spread it. So these are all of the people that need to be vaccinated.
So there's a question in the chat that's asking if someone is vaccinated, but they now are in a setting where a group of people who don't want to be vaccinated with this new Omicron, are they at risk if someone's vaccinated and they are again around people that have refused to get the vaccine? What risk does that pose to them?
Yeah. If somebody's been vaccinated, and let's even say the best case scenario, they've even had their booster, so they have the highest level of protection, even if it's Delta variant and not Omicron, which makes it that much more dangerous, is you can still get COVID.
Right.
And most of the time, most of the time, the vaccine works really well in preventing you getting the infection. But when there's a lot of COVID going around in the communities, as much as 20% chance of you getting COVID compared to somebody, it's 80% chance, let's say, for somebody who is not vaccinated. But 20% of the people that are getting infected right now have been vaccinated. Almost all of them have very mild disease, so they may not get severely ill, but some will. It's not inevitable that you will just get a mild infection, and it means that you can pass it on to somebody else. You can get an asymptomatic infection when you have had a vaccine. So we need to stop this spread. And the only way to stop the spread is by having everybody vaccinated. And if you put Omicron in there, where we anticipate, though we won't know this for maybe a month or so, is that the vaccines are probably not going to work as well with Omicron to prevent disease. It will likely work fairly well to prevent severe disease, but it will probably not prevent, it won't be 20%. It could be 30, 40, 50% that are exposed to Omicron who are, may get it, even if you've been vaccinated. And it continues then the spread, the cycle of the spread to people who are vaccinated, and especially those that are unvaccinated.
So that being said, as one of the co-leads and leaders on this, what would you say are some of the measures that we now have to take a look at? Like we never stop, so we're still trying to vaccinate people. So I think that's the one thing we gotta let people know. We still have not stopped. We are still, because a lot of our communities are not at 100% yet, or not at 80%. So for those, and people hear me say all the time, it's about all of us. It's not about just one of us. And so what are, officials, at administrators and people, leaders at your level now looking at being able to prevent? Is it still vaccinating? Is it educating people more? What are some of the measures now that we have to do to bring a different awareness?
I mean, the first thing is continuing the things that we're doing, as you mentioned. So vaccination, please, please, please wear masks indoors when you are with people other than your household, whether you're going into a store, you're going to have a holiday dinner with a neighbor or with relatives that live across town. Wear masks indoors, whether you are vaccinated or not. And we know that a lot of people are taking those masks off, especially when they go inside with family and friends. They want to hug them, they want to be with them, they want to eat and drink and enjoy the holidays and enjoy being with each other. It's been so hard to be locked down for so long and not to share that intimacy with family and friends. Right? But we've got to keep those masks on, maintain as much physical distancing as is possible, wash your hands a lot. So these are the things we've been saying all along, but we've been getting a little lax, right? Everybody has. Nobody's saying it's one group versus another. So we need to continue doing those things. Right now, nobody is really considering additional measures per se.
Okay.
Like to say that we are now going to go to a lower occupancy in an event, to say that the room should only be 50% full for a wedding or something like that. Those measures may come again, but what we found is that what works really best is wearing masks and maintaining distance. So the idea would be, right now, tables in a restaurant still are supposed to be 6 feet apart. So those things will still need to be maintained.
Great.
And the idea is obviously to push out vaccine even harder. And that means, of course, it means constantly education, 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 and explaining to people that with this Omicron variant, to prevent it from taking hold in the United States, not only handling it once it does happen, but to prevent it from taking hold, is that we need to really get down on those kinds of things. Also, what I think is very important is in our schools. I'm not suggesting we close schools down again, but not all schools are doing testing. One thing that we have been not talking about a lot lately is that we talk a lot about vaccination. We talk about masking and their ads and all kinds of, tweets and all over social media, get yourself vaccinated, wear a mask. But we don't talk about testing as much. And it's interesting, in Europe now, they have begun, in certain countries, they have been able to get very inexpensive in-home tests available for people.
Wow. Okay.
All right. And the thing is, people say those in-home tests, those ones that you do yourself and it develops in 15, 20 minutes, whatever it takes, that they don't work very well. But actually, they work very well if you don't have symptoms and you're just trying to know if you're going to be safe before you go to an event, before you go to a family gathering. And what's important is that you do it more than once. You do it 2 or 3 days or 4 days before you're planning on going to visit your grandmother's house. And also do it that same day or the night before you go. And when you do them in a row, it's called serial testing. When you do it 2 or 3 times in a row, spread out by a day or 2 or 3, the accuracy of those tests are quite good because it's likely to catch you at the right time. The test will catch you if you're positive. And then you know to keep yourself safe, even if you don't have symptoms, to stay home and not to put yourself in harm's way for yourself or for others. So we need to find a way of getting more free testing out there and
That's gonna be my
testing
next
that
question.
is done in a quick fashion. You can get free testing by going to a local pharmacy like a Walgreens or CVS or wherever. But those are usually the PCR tests, and those can take a couple of days to come back. They're not instantaneous. The spit test, right? The test that we are using, the shield test that we're using in our schools, is great because you don't have to put a swab up your nose. And it's very easy. Children can do it. It's not a problem. It's sort of fun. A kid wants to spit into a cup, and we can do those tests. But that's also a PCR test, and it takes at least several hours, if not a day or more, and it's not something that can be done in your home. It has to go to a lab and go through the whole process of going through an assay called a PCR. And schools also need to, those schools that are not doing weekly testing on all of their students and staff really should do that. And it's available to all schools throughout the entire state, free, provided by the state of Illinois.
Wow. As you bring that up, what I'm thinking about is that flu season, right? So when COVID first came out, people really were who didn't even want a flu shot before said, well, wait a minute, you know what? How do I tell the difference? I don't even believe in this, and I get this shot, but I still get sick, or I got the shot, and you know what? I just had so many side effects, forget it. But last year, people were like, okay, sign me up. And so I think we gave more flu shots. And because of that, we actually saw less flu. Well, people are starting to get a lot more lax right now. And so with that being said, do you think as we begin to test that that's going to be still critically important for people to figure out whether they have the flu or they have this Omicron?
Sure, absolutely. The flu and COVID can present in exactly the same way. A cough, a fever, maybe a runny nose, feeling a little bit sick to your stomach. These are all symptoms that could look just like COVID. So absolutely, it's important to be vaccinated against both. And it's interesting, I did not have a cold. I have not had a cold, like a real cold, in almost 2 years because I wear my mask all the time when I'm not with people who are not being safe, right? I've not had a cold just because I've been wearing that mask all the time, right?
Right. And
so those are the things we need to keep doing. And yes, even if you don't believe in vaccination, please, I want everybody to get a vaccine, but at least wear your mask. At least wear your mask.
right.
There have been some newer studies that have come out that have shown that masks really work.
Yeah, I did. It's funny because I will have patients that have now saying the same thing. So you know what, Dr. Green, I realize, as much as I didn't want to wear this stupid mask, I might not take it off because I haven't been sick like I normally get. My kids have not been as sick, as I normally get, And so I want to jump to a different question is that, people are asking about if you could just go back. You started in the beginning, but just explain, this Omicron has, 32 different, mutations on it. And I was talking to somebody earlier. It's almost like a transformer, right? So this thing is just like, and we know that mutations normally happen, but I think we do want people to know tonight what that is, and then why. If you look at what happened in South Africa, they were only 25%, vaccinated. Is there a correlation between not being vaccinated and this Omicron? So it's a two-part question. One is, what the heck is this transformer type of mutation occurring? And if you could just explain that again, and then having an environment where you have that many people that are unvaccinated, why does that put you at risk?
Okay. So first of all, to explain a little bit more about this Omicron, there are these little spikes. That's why you see these pretty pictures of the coronavirus all the time on ads from the CDC or wherever. It's really, it's these 3D, pictures of this sphere with these little colorful spikes on it. It's really sort of pretty. It's this deadly piece of art, right? And you see these little spikes, those little projections. That's how the virus gets into your cells. What happens is the spike attaches to a little receptor, like a little spot, a little placeholder that's almost like a little door, a little hatch on our cells, so that it can get into the cells. So it doesn't just like poke into our cells, it latches onto these receptors. And these receptors are called ACE2 receptors. Okay. So what they have done with the vaccines is that they have developed vaccines that stop that connection to that receptor by having your body build up antibodies, and those antibodies block the spikes from hooking onto your cells, hooking onto that receptor. But you need those antibodies. And so the vaccines are developed in a way that it stimulates your own body. It doesn't give you the virus. The vaccine does not have any live virus in there, but it stimulates your body to develop the right kind of antibodies to block that spike protein so it can't latch on. It separates off. It can't latch on to the cells, right? So, but when there are mutations on these spikes, basically the virus is learning how to avoid the antibodies and can go around and latch on to those receptors. But the vaccines do more than that. The vaccines stimulate antibodies. And that's a kind of immune cell that helps us ward off infections. Antibodies are formed in your bodies all the time whenever you get a cold, when you get the flu, when you get a little fever, a little infection from something, bacterial infections. Antibodies are produced to try to wall off and push out that infection so it doesn't infect your cells, that virus or that bacteria. But what the vaccines also do is they stimulate another part of your immune system. The immune system is very, very complex. But it also stimulates another part of your immune system that works what are called T cells. Antibodies are produced by B cells, but there's also the T cells. And the T cells, if your T cell response increases, and that also happens when you get the vaccine, it helps stop you from getting severe infection. So the vaccine works in a couple of ways. It blocks those spikes. It causes your body to make antibodies so those spikes can't get into your cells. And it also allows this T cell response that tends to decrease your ability to have a bad infection. So with the Omicron, what's probably going to happen is that we're going to see more of these breakthrough infections, which means more people with vaccine are going to get COVID, but they're not going to get super sick from it.
As you're talking to me, because I am a very visual person, right? So I always, the way I would describe it to people is the the B cells and the T cells and how they latch on. But what the vaccine is doing is it's helping your body so that way when it comes, it doesn't say you won't, you can't get it. When it comes to try to attach, your body recognizes and it has a key and it locks it down. And it locks those areas down so they can't penetrate. But Omicron is coming almost at so many different, levels. But the good news is, at least for people that are vaccinated, they have some memory and they got a set of keys. So at least I got a set of keys. I may have to scramble a little bit and figure out, but at least I have some keys. And sometimes that's enough for the virus to say, whoa, it's not going to be an easy fit here, as opposed to if I got no keys and I'm just at the door, then I can't, then I can't move. And so that's an excellent way to describe how the immune system has that ability, because we do know a lot of people, and there's been so much conversation that the vaccine gives you COVID, and that, well, why do I get if I'm going to get the vaccine but I'm still going to get COVID, why bother, and you don't know these long-term effects. But basically what you are saying is that though this Omicron has so many different abilities at different levels to strike, if for those people that have been vaccinated, their bodies have some memory, their bodies have the ability to recognize, and if they were to get sick, their chances are less of being on a vent, long-term care, and being severely sick than someone who has not been vaccinated.
Absolutely. And I love your key analogy. That's a great way to think about it.
Yeah, because as you were talking, I could just, because sometimes if I'm running to the door and you're trying to get in, but at least I got it. At least I know one of them is going to work. I may not know which one right now, but at least I have the keys and I'm going to. So when we think about a lot of our communities throughout that are not vaccinated, they're not at 85%. And when you compare that to what we saw in Africa, now is here in California. So what do you think the chances are that Omicron will show up here in Illinois? We watched in devastation, and we prayed, and our hearts went out for India when we saw the Delta, because we saw the devastation. Because whether you were there or not, the one thing about social media, the one thing about the news is it allowed us a lens to be able to see that. And that was painful for people to watch. But what happened in a short window of time, what was their pain became our same pain. And so how do you think with Omicron that there are chances that what we talked about in South Africa, now we know it's here in California? Do you think we will see that here in Illinois? What does that look like?
Oh, sure. We're going to see it in Illinois. It's in California. It's just a matter of time. Is it going to be tomorrow or next week or in a couple of weeks? I don't know. What I do hope is, because Illinois does have a fairly high vaccination rate, but it's not high enough yet. And some communities have very low vaccination rates, even though the overall average is high. We're hoping that it won't take hold. We won't have it endemic. We won't have it all over the place. The hope would be is that it can be contained, and we would only have a few sporadic cases of the Omicron here and there. But the only way to do that is the things that we've already been talking about, with vaccination and wearing your masks. And if you're not vaccinated, I mean, I hate to say it, for the holidays, if you're not vaccinated, I don't think you should be going and having a holiday party. Join by Zoom. It's your choice. I have to respect it. I also practice medicine. I also see patients. And if you choose not to be vaccinated, I have to honor that choice, even though I might do my best to convince you otherwise. But it means that you don't want to put other people at risk. And this is how Omicron will be spread. It's predominantly going to be spread by people who are not vaccinated.
Yeah, that is a very good point. We know that it's difficult enough for someone that is vaccinated, that there's an opportunity that if they became infected, that they can spread that, right? But now you imagine for people that aren't, here's another variant that's out. And so some of the concern and question that people have also is, do I get the booster now, or should I wait and get a booster? Are they going to have to, reformulate this, and what does that look like? And so why should I get this now? Maybe I'll wait, 3 months and see what's going to happen. But if I got my vaccine and it's been, almost a year ago, am I safe to wait? So those are the questions that I think some people are starting to ask right now about what they should plan and how they should do. What should their next step be?
Well, if you're eligible for a booster, meaning it's been 6 months after your last Moderna or Pfizer, or 2 months after the one Johnson & Johnson, go ahead and get your booster now. It could very well be that it will be determined over the next few weeks that a newer booster needs to be formulated that is more directly, supporting against the Omicron variant, and also potentially other variants that we might predict will be coming out. So you can get another night, we would want to, but so you can get another booster in 3 months, because it's going to take at least 100 days to, is what the manufacturers are saying, about 100 days to put out a new booster. And that's really, really fast. And that's because these RNA, these mRNA vaccines are built in a way in the laboratory that it's very easy to reformulate it, to switch over and to develop, other blocks, so that key isn't there to block off, right, to that won't allow those spikes to get in there. So they can reformulate the vaccines fairly quickly. So if you need another booster in 3 or 4 months, then go for it. But if you're up for a booster now, do so. And what we've been finding with the boosters is the booster doesn't just improve your immune response back to what it was after your second dose, because we know it begins to get less effective after 6 months or so, but it boosts it even higher than it was after that second dose. So it gives you even more protection.
You brought up two good points, and that was an excellent way to explain that. And so when you get the booster, some people are saying, well, I had a headache before, or I felt fatigue. Now that I have a booster, is it the same amount? And am I going to get the same side effects? Is it going to be worse? Is it going to be better? If you could share with us, because there are people that still want the booster, but right now I'm still just a little afraid about what's going to happen now.
I had my booster, and it felt about the same as the second one. I had Pfizer, maybe about the second one as Pfizer, maybe even a little better. My arm was sore, and it wasn't as sore after the booster, which is interesting. And then the day after, I felt really under the weather. I just sort of felt draggy and tired. And my daughter, who's 21, she was just home from college for Thanksgiving. While she was here, she got her booster because it had been 6 months, right? She got her booster. She just laid in bed all day and got up here and there, and she just wanted me to take care of her like I was her mom, which I am,
Yeah.
right? So that was fine. And then she was fine the day after. She went back to school, so she felt sort of draggy again for a day, okay? She had a little bit of a headache, no fever. And she's somebody who's 21, so she's somebody who's younger, who has a really strong immune system, who's also more likely to have a reaction after a booster because her system's really going to go into overdrive, right?
Right.
And she did really well. She certainly felt no worse than when she had her second shot. So of course people are afraid. That's why people say that they don't want to get the flu shot, or it's going to give me the flu. Well, it doesn't give you the flu, but again, you might feel yuck, right? That's why I say yuck for a day
Right.
or so. Right.
Yeah.
And so, yes, it's true. But imagine what it would feel like if you had a severe case of COVID. Even a mild case of COVID isn't real comfortable. Right. Imagine what you would feel if you got COVID, as opposed to this discomfort from a booster that might last a day or two.
Right. And so, speaking of that, one comment I want to make too. The other thing is, I think we have to realize too, for those people that are not vaccinated, again, and I agree with you, it is their choice not to be vaccinated. But I think to be unvaccinated and unmasked is unfair. It's unfair to the general public, and it's unfair to the healthcare system. When you look at the nurses, the doctors, the respiratory therapists, the clerks that sign you in, I mean, it's been a journey. And I tell people, these are the same people that have showed up for work, who've still been trying to figure out Zoom for their kids. They're tired as well. But we have to be mindful of our state of healthcare to ensure that when we make choices, that our choices don't just affect us. They affect everyone else. So I had to, mention that. But there's questions also. There's one in the chat about, for those people who got the Johnson & Johnson, should they get the messenger RNA? Oh, and that's the other point I was going to make. I'm glad you explained it, because people, they're reformulating. They're not starting over, because a big concern for several people is that this technology was too new. But in fact, what you're saying, because of this technology, it's an easier way. It's like that locksmith he has the imprint now and has the ability then to watch this virus, see what it needs to do to manipulate that, as opposed to it's sitting in a petri dish for another X amount of time. So I'm glad you explained it that way so people can, understand that. So, but the question is for those who've had the Johnson and Johnson, is that enough protection for them? Do they still, because they only got one shot and that was supposed to be okay. So in fact, do they need a booster? And if they get a booster, which vaccine should they get?
Yeah, no, if you've had the Johnson and Johnson, that's why they're even saying get it after 2 months after having the one Johnson and Johnson, that you are eligible to get a booster even just 2 months, not 6 months after having it. Johnson and Johnson vaccine provided a decent amount of coverage, more protection than you would get frequently from an equivalent flu vaccine that doesn't quite work perfectly every year, but it works really good, but not as good as these mRNA vaccines. So the Johnson & Johnson has worked very good. And anybody that chose to get a Johnson & Johnson, that was a wonderful choice. You took what was available, what you felt comfortable with. You thought it was one and done. Well, you need a booster. What can I say? You need a booster, and you need a booster with the mRNA. A booster with Johnson & Johnson, I think, is also possible, but that's not what's recommended. It's really recommended that you get a booster with either the Pfizer or the Moderna, because that will give you the longest and best protection.
Gotcha. So as we, think about, and we were talking about, the kids, and for those who have not gotten vaccinated, with this Omicron and being into, coming to the next holiday season that we're getting ready to have in the next couple of weeks, what is your opinion in light of all of that for the kids who are eligible? Should they get vaccinated now? Is this another reason to say, you know what, I've been on the fence about my kid, yet I do want to have them tested on a regular basis, and having the availability of more testing, of course, I agree with you completely, is important. But what do you say to the mom who, well, now, heck, it's another variant. Should I go ahead and make that leap and get my kid vaccinated?
I would say absolutely. Get your child vaccinated, because remember, if we have boosters out there eventually that are reformulated to be a better fit for the Omicron vaccine, you still want them to have that basic vaccine. You want them to have that initial 2-dose vaccine to give you that basic initial level of protection. And then you'll get that much more when a booster is around, whether it's the current booster, when they're at this point, boosters are not recommended at this point for anybody under the age of 18, though Pfizer is saying that they are applying to have it approved for 16 and 17-year-olds. But that being said, you really need a 2-dose vaccine. You really need to have a good, strong vaccine for your children. Children, we know, generally speaking, unless they have one of these chronic diseases or cancers or things like that, tend to get mild disease. But there are still children that are getting hospitalized. There are a few fatalities amongst children. And of course, that tears our hearts out. These are
Absolutely.
our children. These are our futures, right? So the idea is to protect your children. And again, it's not only to protect them, but it's also to protect their grandparents. It's to protect their aunties. It's to protect their cousins. It's to protect their elderly neighbors, right? Because these are the folks that are going to get infections that are going to be very severe that they can't recover from.
Got you. So when you talk to patients, and they say, okay, I got the booster now. Is this something that I'm have to get every 3 months? Though I had a patient who recently told me, she said, she's seen so much devastation by COVID. She was like, if there's a booster every 3 months, sign me up. She said, because that, and when you talk to people who've had, who didn't think they could get COVID because they did everything right. They did the vitamin D, they did the echinacea, they took the oil of oregano, and then it still, it devastated them, right? And so what do you say to people if this variant is now, but a year from now we have another variant. I mean, will we ever get out of this? I mean, and that's the question that people keep asking. We're going to year 2 right now, and why do I continue, or should I continue to get a vaccine?
Yeah, we recommend flu vaccines every year. I think that that's what's going to be happening with coronavirus, with this particular SARS-CoV-2, that it is a kind of a virus that mutates. Some viruses are more likely to mutate than others. In fact, the flu vaccine mutates more than the coronavirus, but it does mutate. And I think what's going to happen is eventually it will reach the point of needing yearly boosters. And there's even some manufacturers that are working on having a combined flu COVID booster at one time. So you might only have to have one shot and you get protected over for both diseases or both illnesses for the next year. I can't say whether we're going to recommend another booster for everybody that's gotten them now over the next year, or if we'll be able to wait for another year from now. So you got your booster and then you wait another year. Can't say that yet for sure, whether we're going to need a booster after 6 months or whether it's going to be a full year. But I think eventually that's what's going to happen, that we get the pandemic under control. Instead of there being an epidemic, it's what we call endemic, which means that the virus is always there at a certain low level. And there's going to be maybe certain times of the year where it picks up, like in the winter when we're indoors, because it's more easily spread indoors. And therefore we get our boosters before that season. That's why you get a booster in the fall before you're indoors all the time in the winter. Right?
I'm smiling because I'm thinking to myself, we've been in this so long. I forgot that there is a state of endemic as opposed to the epidemic, because we've been in this, for so long. But when we look at our communities across where we were low, and you now see that the work that, you guys have been doing and that all of us have been trying, it's helping. We can see our communities starting to improve. And so, before we end tonight, I think one of the questions that people have about this, with the variant and everything else, is that, okay, there's this vaccine and there's the flu shot. So as you just talked about, should you still get, the flu shot? So you want me to get the variant vaccine, booster, and get the flu shot? Do I get them together? Do I wait a month apart? What do I do? And so I think before we close tonight, we definitely want to be able to answer those questions for people about, kind of this wrap up of, so how would you begin to wrap this up and answering that for people? What would you say?
Yeah, you still need to get the flu shot because they're two different viruses. They create two different illnesses. And we are seeing more flu this year. Last year, we had a very low level flu season because people were inside. People were not with each other. People were beginning to wear masks. But now, we have what's called COVID fatigue. People are tired of doing those things. And understandably, I'm tired of doing it too. But now we're beginning to see more flu infections this year. And we don't want to see that because flu can be a devastating infection as well. And so we need to be vaccinated against both. I mean, we keep thinking, why are all these vaccinations? How many vaccines do you give your kids? Right? And it's to protect them, right? And it's to protect them, right? Lifelong. And then there's certain vaccines that children as well as adults get on a periodic basis, such as the pneumonia vaccine, the flu vaccine, tetanus vaccine, right? These are the things that we do have to get on a periodic basis, maybe not every year except for flu, but we still have to get them repeated. It's not like one and done. So there are adult vaccines. People think, oh, it's just for kids. No. Adults, we need to protect ourselves against serious illnesses like the flu can become, like the pneumonia can become, etc. So definitely get the flu vaccine, definitely get the COVID vaccine. You can get them done on the same day. When my daughter went and got hers last week, in fact, it was on Friday night, I took her over. She had made an appointment. She did it herself at the local Walgreens. And they asked her, and she said, I signed up for both. And they said, do you want it in two different, you want it one in each arm or do you want them in the same arm? She says, oh, just give it in one arm. I just want one sore arm. Right? So she got them both in the same arm. I don't know if I would have done that. I might have split up, right? but she got both at the same time, and one and done. So she was done with those boosters, and she was fine. Right? So
Wow.
get both. Get both.
All right.
And you
And
can
so,
do it at the same time.
right. So, I mean, tonight has been a lot of information. And I think, and I thank you, for that level of expertise. It sounds like, Omicron is doing what viruses do. And as you mentioned, the flu virus does that. But the vaccines now give us the ability to respond at a different rate that we would not have been able to respond at. And so I think as people are looking at their communities, you brought up very valid points about the holidays approaching. And I look at the weather tomorrow, it's going to be almost 60 degrees here, 59 degrees. So people are out, people are tired, people are comfortable, right? But that I think really knowing that this is real, that was what was in South Africa is now in California. At some point, it will be here. And when it is, how do you stand? And I think that's what the whole conversation about was tonight. Are you prepared? We can never be 100% for everything, but I think the message tonight that you've allowed people information to make wise choices about how they respond to this virus. And again, the reality of that is that we do have some things within our power that you mentioned. Wearing a mask, social distancing, going to get tested frequently. Those give us the power to do something. And so I think having that information is just paramount. So we only have a minute or two left. What would be your closing, notes? To what do you say to a community that says, I'm sick of wearing a mask? I've gotten the vaccine, but my family members still don't want the vaccine because they think that it's a computer chip in it, or they think that we're giving people COVID, or they think that I'm going to be sicker later. I mean, those are the things that people are still they thought they had just gotten to a point that I could breathe a little bit. And now what you're saying is I can't breathe that easily just yet. So what do you tell people how in light of this? Because what we don't want to do is have panic or fear, but we want to give information that people can make wise choices. So in this last minute or so, what would you tell people?
I would tell people, let's do this together. Let's do this together to be safe for ourselves and our communities, our families and our communities. You're not just doing it for yourself. We're wearing masks, we're getting vaccinated, we're having that social distancing for just a little while longer, because we want to keep our communities safe. You're doing it for your grandmother, you're doing it for your neighbor, you're doing it for your community. And we can celebrate safely over the holidays. We really can. If we do the right things, we can celebrate, and we can be with our family and friends over this holiday season.
Thank you so much for making sure that you gave us information. You came on tonight to ask the doctor. So you took what you do in the office and you brought it right into people's homes for information. And that goes to I Am My Brother's Keeper. So thank you for the time tonight and even sharing about your daughter and her vaccine. That lets people know that you're real, that this is real. And that's what people want to know. They just want to know that the information that they're getting is trusted and it's true to the best of their ability. And that, public health, we actually care. And it is that. And it's a partnership. So thank you so much for tonight. So those, please, go to Facebook. It'll be on there. Look on Twitter, on Instagram. Share this information out with your family and friends. So have a safe holiday. And again, thank you so much, Dr. Rubin, for tonight.
Yeah, thank you.